Hello friends, today we will be discussing about the biting habits. Habits, as we know, it is a fixed or constant practice established by frequent repetition. Today we will be discussing about different type of biting habits. Biting can be lip biting, cheek biting and nail biting. We will discuss it by one. Coming to the lip biting involves manipulation of lips and perioral structures. There are two types of lip biting. First is wetting of lips with tongue, and second, pulling of lips into mouth between the teeth. Now coming to the etiology, there are various etiology involved in biting. First is malocclusion, that is class 2 div 1. In case of class 2 div 1 where maxilla is forward, in those cases lower lips is mainly bitten by the patient. Second is habits. Sometimes lip habits is associated with thumb sucking. And third is emotional stress can also be an important factor for lip biting. Then coming to the clinical features, lip habits can lead to the protrusion of upper incisors. Then it also leads to the retrusion of mandibular incisors, and sometimes lips may be red, irritated, chapped below the vermilion border. These all are the clinical features of lip biting. Coming to the treatment plan, lip habits are deleterious with age because with age the muscular forces increases, so the lip habits becomes deleterious and harmful with age. So the correct treatment will be correction of malocclusion. If there is class 2 div 1, we will first correct it and then we will give the appliance therapy, like oral screen can be given for 3 to 6 months. Now coming to the second habit, that is cheek biting. Cheek biting is the chewing of oral mucosa, also known as mucosa oris. There are various factors involved in cheek biting. First is emotional factor, second is physical factor, and third is psychological factor. So what will be the clinical features associated with it? First, there will be ulcer at the level of occlusion because of the constant cheek biting. There will be open bite at that region, and there will be tooth malocclusion. Coming to the treatment plan, for cheek biting, we'll give the removable crib. Sometimes vestibular screen can be given, and for the ulcer, we will give the oral gel or the lubricating agent to apply on that area. Now coming to the third habit, that is nail biting. Nail biting is very common in people. It mainly occurs at 4 to 6 years and gradually increase with age, and it is absent in children below 3 years. Coming to the various etiology, first is emotional problem. Those children who have typical more than 15 cycle of nail biting, they will also have the habit of pencil biting, hair twirling and gum chewing. Coming to the various dentoalveolar effects of nail biting, first is dental effect. Nail biting cause crowding of teeth, rotation of the lower teeth and adhesion of the incisal edge because of the continuous biting of the nails. Then second, nails, there will be inflammation of the nail beds and nail will be red, smooth and extra clean. Coming to the treatment plan, you should not scold your children for nail biting because it may cause worse effect on their psychology. For mild nail biting, there will be no treatment. Try to distract the children and help them in outdoor activities. Sometimes nail polish and light mitten can be applied to the nails. Counsel the children and help him